Broken Hill. On a remote Northern Territory island, a group of Indigenous women have started their own health retreat, combining modern medicine with traditional practices. Already, many of them are showing significant improvements to their health, as Nadia Daly explains.
Hunting and collecting in the mangroves, reviving a daily ritual where the land is the larder on Elcho Island off the tip of East Arnhem Land.
They fishing, crabbing, collecting all the shells, mud shells, everything, then bring it back on one day. We ate only fresh.
At home in these dense mangrove forests and slippery mudflats, 54-year-old Helen Rikawoko is taking steps towards better health.
Reading arangoni rally Miriam, tipal nailil, criplil, pili ngarakan facing the problems.
Nutritious food in remote communities doesn't come cheap when groceries are brought in by barge once a week from Darwin. For Helen, it was a vicious cycle.
Ngaranganguni maram komurdan ngatang ugaling or ripinganguni nyumukuning uran ngata ngarakanuni lukan oripunyara wala lang malpur wala lang ngata lukan wangga mirian.
This group of Yolngu women have overcome chronic illnesses by going back to the land and the ocean.
And this a little bit too small one also.
They're on a mission to bring the best of the old ways to a younger generation by trying to start a health retreat here for the community on the island. Tired of seeing sick relatives flown to Royal Darwin Hospital for renal dialysis treatment, the women decided it was up to them to do something.
Sometimes they have a really big problem, then they leave this community, go, and also they leave the families. Until when they die, then they come back here. Only body come back.
More than 500 kilometres from Darwin, on one of the most remote islands in the Northern Territory, Yolngu people lived off the land for thousands of years until Europeans established permanent settlements on Elcho Island in the 1940s.
70s, there's a shop went. 80s, yeah, it was a shop, really big one. No chance to go out to collecting all the bush tucker.
As the Yolngu diet changed, the women say their health declined.
Before, our own people were fit and healthy. The main, at the clinic, it's all chronic, I can say.
The health retreat project began with just a few women, overhauling their diets, quitting smoking and going out bush to hunt. After a few weeks, the results were clear and the others wanted in. They formed a group embarking on a very ambitious project.
To improve ourselves first, then we can help our community, our people.
With the help of a non-government organisation based on the island, the 12 women launched a crowdfunding campaign for a trip to a Brisbane health retreat to learn the ropes. They were overwhelmed by donations. The retreat taught them how poor diets affected their health and how modern medicine measures the risk factors for disease. Now they're taking that knowledge back to Elcho Island, where they're working to open a health retreat incorporating Yolngu traditional knowledge. The women took us out to this isolated spot in Gawa, an outstation hours from the main town. It could be the future site of the retreat, but first the women will need funding to construct a building and to train community members to work there.
So it's a beautiful spot here. Is this the sort of place you think you might start the retreat?
Yes, this is the best to have, to start here. And for health retreat, it was like away from the town and the city. It
Somewhere
was
like this?
Somewhere like this.
So this one, this
In the main community Galawinku, they hope this abandoned women's centre can be transformed into an education hub to train retreat workers and run cooking lessons. For many of the women, it hasn't been easy to stay on track with the abrupt changes to their old lifestyle, but it's the stark transformations that have kept the women going.
Nowadays we'll have to practice it to young people, give in a different way, new way of living.
Aboriginal and Torres Strait Islander rates for diabetes are almost 5 times higher than for non-Indigenous Australians. In the year since they began, 8 of the 12 women have been told by their doctors they can stop taking prescription medicines for chronic conditions like diabetes and high blood pressure. A radical change in diet allowed 57-year-old Dorothy Jungiringa to stop taking insulin for diabetes on the advice of her doctor. Almost half of Australia's Indigenous adult population smokes. 6 of the women in the group of 12 were smokers. 4 have quit, but the journey isn't over.
Marngarato kanin aja markuleo kutara miringo malara kalangau ka kaminya miringo kana na ngalegoro to kanina miricin del tipo maraka jal pirngarato macin mangi kom na kangura del cingol miricin ngarato jamar kulnya mangi kom gara ko ngara pito kada kinuni.
Nadia Daly reporting from the Northern Territory.